Welcome attendees to the final session of CASA of Los Angeles's virtual early childhood convening. My name is Lori Halderman and I'm the program manager for early childhood at CASA of Los Angeles. To start us off today, I would like to introduce Megan Maddock, the Chief Program Officer for CASA, who will be sharing some opening remarks with you. Megan?
Hi, Lori. Thank you. And thank you to all the attendees here today. I can't believe it's the final day of our early childhood convening. Thank you all so much for being here today and for joining us for the other 2 days of the event. I'm really grateful that this event has brought so many of us together, whether it's attorneys, social workers, other CASA programs. I'm really excited that we have this group of folks ready to commit to supporting our littlest ones. And to start today, I wanted to share a memory I have. So I am a social worker. I worked for DCFS before coming to CASA. And this is a memory from my very earliest days of a social worker when I was very green, very inexperienced. And one of my first cases was actually with a little one. So she was about 1 year old. And I don't have kids myself. And I remember going to the visit and saying, I have really no idea what to do here. And, I was like, okay, crib check, bottles check, diapers check. This is gonna be so easy. And what I wish I had known when I was that very green social worker is that little ones are complex emotional and social beings. And that case ended up involving a lot. Regional center, a lot of family members in the picture, which was great, and also complicated. A lot of needs that the resource family had to put in place to support that little one in her development. And it took truly a village to pull it all together for that family. And I think it's a good reminder that young ones in care and young ones all in general have these needs, and that we need to pay attention to them as professionals and people who care about our littlest ones. Early intervention and engagement with our youngest children are so important and can mitigate trauma experiences throughout a life. That little girl had a family that loved her, and now I know as a more experienced social worker that all of us, family service providers, CASAs, can do something to ensure healthy and caring relationships for our youngest ones. So I want to thank you all again for being here today, for sharing in this learning about young children. And I'm gonna pass it over to Lori. I'm really excited for this panel today. It would have really helped me 7 years ago when I was in that situation. So I'm really glad to be learning from our panelists, and thank you, Lori, for this amazing convening.
Thank you, Megan. If you all think back to day one, Dr. Nicholas talked about the importance of young children having healthy relationships with consistent and caring adults to help the young children learn to regulate and ultimately develop resilience. The adults have to be able to regulate themselves as well. Many of my coworkers know that I use humor as a tool to both educate and self-regulate. I know that if, as an adult, I can find humor and joy, then I know I'm in my prefrontal cortex and can use those all-important executive functioning skills. So if I do this right, and I share this picture with you, hopefully you all can see it. There we go. I want to share this picture. So as we launch into this final session about social and emotional health of young children and child welfare, I wanted to share this humorous rendering of a toddler's brain to remind us that the young children we serve are children first and foremost, and unwanted members of child welfare second. So I love all the different parts of the brain, such as the phone call interruption ganglia and the endless repetition stem. Probably the most annoying of this toddler's brain is the whine region. Many of you experience that, or the hygiene avoidance, such as toothbrush, nail clippers, using the potty. So this is just a humorous way to launch us into the next part of our convening. And as we do that, I do want to launch our next poll. Let's see if I can get to the next poll. If not, there we go. I want to launch this poll. Here we go. Let me see if it'll let me launch. And this is again an example of stress where something is not working and we might not be doing a poll today. So we're going to skip our poll for a minute and launch through to introduce our panelists, and then I will hopefully maybe at the end come back to the poll since it appears not to be working correctly at the moment. So thank you for your patience with that. So let's move on to our wonderful panel. First, I would like to introduce Adriana Molina. Ms. Molina has spent over 20 years working with at-risk children and families, coping with everything from living with AIDS, extreme poverty, domestic violence, gang culture, and child abuse and neglect. Her professional experience includes social work with the Los Angeles County Department of Children and Family Services, crisis response with law enforcement, and field work and program management. Ms. Molina is a CA, or a California CIF ECMH endorsed infant and family and early childhood mental health specialist. I challenge anyone to say that 3 times fast. And a reflective practice facilitator too, and is currently the Chief Program Officer at Allies for Every Child in Los Angeles. An adoptive parent, her focus in recent years has been to educate the community and stakeholders about early childhood mental health and strengthening systems of care, communities serving children 0 to 5 and their families. Ms. Molina is also co-chair of the Community Violence Work Group of the National Child Trauma Stress Network. Welcome, Adriana. Next, I would like to introduce Kathy Malasky-Samu, a CASA, and the founder of Los Angeles Office of Child Care. Ms. Malasky-Samu began her career in early education by working in Wilder Foundation-sponsored full-day childcare program in the very toasty St. Paul, Minnesota. She served as an assistant director of the Child Development Center at Pacifico College. She joined the staff of the Child Care Information Service, CCIS, in 1978 and became executive director of the agency later that year. In 1988, she was hired as the first child care coordinator for Los Angeles County. From that position, she developed the Office of Child Care, which assisted in the development of 7 county employee child care programs, managed a program supporting the educational advancement of early educators, developed and implemented a child care quality rating and improvement system known as a QRIS, and analyzed local, state, and federal policies related to children and families. She holds a BA in child psychology from the University of Minnesota, a master's in human development from Pacific Coast Oaks College, and a master's in urban planning from UCLA. She is retired the County of Los Angeles in 2015 and enjoys volunteering as a CASA, and a member of the Child 360 Board of Directors. I have to advertise. Next, I would like to introduce Charity Vasquez, Assistant Professor and Director of the Masters in Child Life Program at Azusa Pacific University. Ms. Vasquez earned her bachelor's in child life and master's of science degree in child development from University of Laverne in 1998. She functioned as a certified child life specialist, or CCLS, since 2000, working with hospitalized children and their families in various healthcare settings. As a CCLS for the hospital, she also worked in the community through a First 5 grant, working with children and families in residential substance and shelter/group home settings. From direct support, she progressed her career advancement in various leadership roles, including administration as a child life manager at UC Irvine Medical Center. She is active in the child life community, both in healthcare and academic realms, participating in various committees, including within Child Life's national organization, Association of Child Life Professionals, and holds a board position with California Association for Child Life Professionals. She is passionate about global child life work and is looking forward to sharing integration of child life services and the role child life specialists play in addressing the social, emotional needs of infants, children, youth, and their families. Finally, I would like to introduce Griselda Hernandez, Social Emotional Coordinator Specialist with South Central Los Angeles Regional Center. Ms. Hernandez started her career in the early Head Start field as a child development specialist. In 2015, she started working for South Central Los Angeles Regional Center as an early start service coordinator. In 2018, Ms. Hernandez became a social emotional coordinator specialist. In this role, she collaborated with several mental health agencies to create a referral process for children and families who needed mental health services. She also established a closer partnership with South Central Los Angeles Regional Center Early Start vendors by developing a referral process to streamline referrals for additional services for children who needed mental health services. Ms. Hernandez has facilitated parent trainings such as Hanen Spark, Positive Parenting, and Incredible Years, Babies and Toddlers. Ms. Hernandez has received a bachelor's degree in social work and is currently working on her master's in early childhood education. Welcome, everyone. Thank you for being here. What I would like to do is start with our first question. As you know, you each have 5 minutes. There's our cute little sign to warn you when you have 30 seconds left. Very fancy, I know. So I would first like to start with Adriana on our first question or statement. Please share how you and your organization support and encourage social emotional development of young children in child welfare. Please also include what services and supports you and the organization offer to young children and your families.
Right. Good afternoon. Thank you for that amazing introduction. I'm always impressed by what I sound like on paper, which is much different than how I experience myself. But it is a great opportunity to be here. As you mentioned, I am an adoptive parent. And like Megan mentioned earlier, in a previous life, I was a CSW for about 30 seconds, the equivalent of 30 seconds. And so the opportunity to be here in conversation with the CASA efforts is really key, because I've seen, as a recipient of services and as a person recommending CASA services, the difference that it makes for kids. So thank you, Lori, for making this happen and putting this together. I will tell you all about Allies, but I also need to acknowledge that a lot of my early childhood thinking came for many years as I was employed by Children's Institute as part of Project ABC, which was an early childhood system of care effort that really allowed me to get grounded in not just the physiological needs of babies, but the emotional needs of babies, and why it's important to think about this transdisciplinary work. And so I now have the opportunity to be part of the leadership team at Allies for Every Child, which is a child-centered, family-focused service agency that provides a continuum of services that go from prevention to intervention services, including community outreach, parent education, and all the way through early care and education, and infant and early childhood mental health services to help families, all the way through foster and adoption services. And all of that is with the goal of creating strategic partnerships multidisciplinary services that will allow children to have the childhood they deserve. And so all of these efforts, all of these services that we offer are in partnership with the community. We are working very explicitly to make sure that we are listening to the parents as leaders in their community and as experts in the life of their child, so that we know how to better adapt our services. I think one of the primary examples is that Allies, which previously was known as Westside Children's Center, started with foster and resource family services. And the recognition was that the data was telling us that over 60% of the kids who come into care, the 5 and unders, are because of neglect. And so it necessitates that we have a supportive system of services to help the parents who need additional coping, additional strategies, additional childcare, additional education, additional mental health, additional whatever it is that they need, so that we can reduce the number of children experiencing neglect and therefore reduce the number of kids that we need to have entering the child welfare system. So I'm sure I could say more, but I want to hear from other folks on the panel. Thank you again.
Thank you. Griselda, would you answer next, please?
Sure. Hi, everyone. I'm so excited to be here and be a part of the CASA convening with my great co-panelists. They're all amazing in everything that they do. As Laurie mentioned earlier, I am the social emotional coordinator specialist with the South Central Los Angeles Regional Center. And in 2018, we were awarded a MHSA grant. And with the grant, my position was created. So originally I had experience as an early start service coordinator. However, I've attended several trainings along with other regional centers, such as a side-by-side training where actually, Adriana, I saw you sing at one of those trainings, if you remember. I actually participated in the whole training. So I have vast experience working and helping our families that come into the regional center with additional social emotional support. As you mentioned, I've been trained in Hanan. I've been trained in positive parenting. We do social emotional training for parents and helping them identify what their child's needs are. Along with children who are in the child welfare system, we do get a vast or a high amount of referrals from DCFS cases, and we do support our families tremendously, especially in the social emotional area. And so I've collaborated with several mental health agencies within SPA 6, which is the area that we service. And we also have the Family Resource Center that helps and provides different trainings for not just for our families, but also for we collaborate with different agencies within our area. And thank you. I'm happy to be here.
We had a question, Griselda. What is HANA? The program?
HANA is a training that originated in Canada, and so it got open. Now it's worldwide. It's to help facilitate communication. So most of our referrals that we receive at the regional center are for communication delays. Our babies aren't talking yet; they're just gesturing or grunting, and so I've also been trained to help children who have a diagnosis of autism and getting them to communicate. And so it is a training that was provided to regional center and to some early Head Start programs. We hosted them at our regional center, and it's a training to help parents facilitate and develop language development with their children.
And I'm just going to ask one more question. There may be some folks on here who've not worked with or heard of Regional Center. Could you just give a 1-minute description of what Regional Center is?
Of
if
course. So
possible?
regional, I might need more than a minute, but the regional center there's 21 regional centers in all of California. So only California has regional center agencies. And we, in the early start department, so we have two departments, the early start department and our Department of Children and Adult Services. So for us, our regional center early start focuses on children ages 0 to 3, and they qualify for services if they have a delay of 33% or higher in 5 areas of development. It's either cognitive, communication, which covers receptive and expressive, social emotional, adaptive, and motor development, which covers gross motor and fine motor.
Okay, thank you.
You're welcome.
Okay, Kathy, I know your former career before you became a full-time CASA was in early care and education and childcare. So can you share how that work supports the social and emotional health of young children?
I'd be happy to, and you might need to show me my time to shut up sign because I've got a lot here to share with you all.
Well, you might get extra time because other people went short. So,
oh, I'll use it. I'm going to speak rather globally, and I do want to let folks know that I did do a handout that Lori will share with specifics on how to find childcare, learning about licensing regulations and resources. And so I'm going to speak globally, but there will be that specific local information available on the handout. So high quality child development programs can provide incredible supports to families. When a new baby would arrive in our extended family, my dad's comment would always be, well, that house is under new management. And, and I do want to say that children bring incredible joy to a family, but they also bring a lot of stress. And most families, biological or foster, at different points really benefit from getting support and sometimes from giving support, showing that they've gotten through a tough phase. And the Strengthening Families model, which emerged from research in high quality child development programs, identified 5 key factors that early childhood programs can provide to families. And the first of these is concrete support in times of need. And that can be anything like some programs share clothing or toys that their children have outgrown and another family might really need. It might be advice on how to deal with behaviors that are driving adults nuts. It might be a referral. This kind of just support being there. The second item was knowledge of parenting and child development and helping. We're not living in the same kind of communities we used to, where there would be a lot of support surrounding families. Oftentimes they're really on their own with a new child, and helping just knowing when it's appropriate to start toilet training, or why biting isn't a problem with 2-year-olds, but could be a problem with a 5-year-old. Kind of sorting out some of these things that can make parenting much more manageable. The next item was parental resilience. And just recognizing the stress of being a parent, of being on 24/7. Sometimes just sharing a positive story about the child's day can really boost a parent's sense of success with their child. And the fourth item was social and emotional competence of children, helping children learn to listen to directions, how to share, how to recognize and regulate their own feelings. Those can really make life a lot easier for a family when the children begin to develop those skills. And finally, just social connections, connecting parents with other families of young children. So you have somebody that understands what you're going through, to see your child with other kids and how they function. And I think sometimes too, seeing staff in a child development program, how they manage and work with kids. All 5 of those things are critical to high quality child development programs. And with children and child welfare, I think it's so important that they have the experience of being in a safe and appropriate environment where they can actually focus their attention on playing, learning by doing, just the stacking of blocks, painting at an easel, shaping clay, using scissors, seeing what floats and what sinks in the water table. Um, all of these things are important for young children to experience, and they actually form the foundation for academic and social skills. So it's very important that they have those opportunities. Um, Let me see. It's also wonderful for children in the child welfare system not to have to be monitoring the adults' behaviors around them, um, that they can really let down that vigilance and focus on what their work of playing, that they can actually learn that some adults can be trusted to care for them, to know them, to like them, and even love them. And this builds self confidence and sense of self worth in the child. Knowing that there's enough food, enough materials, enough space um, can also reduce a child's stress. Knowing what comes next, what the routine is, allows the child to fully engage in their world. High quality child development programs are using, more often using tools like ages and stages questionnaire that is completed in conjunction with parents, and that helps parents and teachers be on the same page about working with the children. Um, I guess in closing, just most children are going to some kind of early childhood program. We want our kids in the child welfare system to have that same experience, to arrive at kindergarten knowing how to function in a group. Thank you.
Thank you, Kathy. And also we'll be uploading into the chat box a handout, which we call the 6 protective factors. So keep your eyes out in the chat box in a minute or two for that handout. Charity, would you like to address this question as well?
I was going to say good morning, but realized it's 12:30, so it's not really quite morning anymore. My name is Charity Vasquez, a certified child life specialist by profession, and of course, as Lori had mentioned, a current director for our Master's of Science in Child Life degree program at Azusa Pacific University. And so, before starting the Child Life graduate program at APU, I worked as a child life specialist in a variety of settings, providing direct patient care and support at a children's hospital, working with pediatric patients 0 to 18, starting from NICU setting to general pediatric, intensive care unit, oncology, cardiac, outpatient area, and emergency department in itself. And also as child life specialist, I was also had the privilege of working with families seen at maternal fetal medicine for high-risk pregnancy alongside perinatal team and palliative care team, because that continuity of care and support to children and family is very important, as we all know this. And then from Children's Hospital, I transitioned into leadership as a director for the Child Life program at UC Irvine Medical Center. So my role as Child Life specialist, providing direct patient care, and as Child Life director, providing indirect care, is all to support and advocate for the social and emotional needs of young children in our care and those who we are committed to serve. And so, while I was able to provide support as a child life specialist, just like any other child life specialist, to enhance the healthcare experiences and advocate for their voices, or to be their voice as program administrator. The important part is being able to implement programs and initiate policy that influence their lived experiences as pediatric patient in the medical setting, and whether if they are, going through terminal illness, chronic illness, variety of traumas that they're coming in, abuse and such. And so when children are hospitalized, oftentimes we become their, forefront advocates before they get discharged and is placed into various child welfare systems. And that is essentially what child life specialists do, applying our competency to meet the psychosocial needs of our infants, children, youth, and families in our environment. And so a brief overview of child life, you saw the link there. If you're also interested, you can certainly visit Association of Child Life Professional at childlife.org. This is our national organization that creates standards and policies and things like that related as far as practicing as a child life specialist goes. But as child life specialists, we are allied healthcare professionals. They're to normalize the environment for children, to give children opportunity to be children in healthcare setting, despite adversities that they're experiencing. Advocating for their healthcare experience by preparing them for surgeries and procedures, diagnosis, teaching, and education, accompany them to procedure and surgeries, pretty much helping them ease their stress and anxiety, because they're not going to have a familiar, a consistent advocate person at their bedside. And so child life specialists become those individuals with them while they're going through procedures. And also developmentally appropriate language explanation for things that involves them, because they have the right to know what's happening with them as right-holding citizen, right? And again, as a, we tend to not explain things to children because we want to protect them, but they have, the need to know what's going to happen to them, to their body, and which part is being affected, right? And so as child life specialists, we're also the liaison between school and hospital when children are being discharged from the hospital to go back into preschool or to go back to K through 12 system, reintegrating them into that new normal for them. And also even preparing them to go to a foster family in itself, working with, partnering with LCSW in clinical setting to talk to them about, what is it, why they're going to foster systems and such. And so parent support and education is also another area, and sibling support and education as well. And so collaborating with multidisciplinary team is very important. At APU, I would say that as we're growing the next generation of certified child life specialists to influence, support, and encourage the social and emotional development of young children in child welfare beyond healthcare setting. And so to some, they need caring, consistent adults in their lives that work together, right? So.
I had one follow-up question for you, Charity. How might somebody who's working with a child in foster care, who's having a pediatric experience in a hospital, secure having the involvement of child life specialist?
Yeah, so, if a child is, consistently being followed up by, pediatrician or clinics, they can refer, they can ask for a certified child life specialist that might have worked with the child in the hospital and so there definitely is a need for child life specialists to be beyond the hospital that has that specific training. But yes, definitely requesting the need. And there are also child life specialists who do consultation rather than work in the hospital. So there's also that opportunity as well. Yeah.
Okay. Thank you. Because not everybody has heard of child life specialists.
Yes. I can talk about that forever, really.
So I'm going to ask our next question. So I've heard about some wonderful services that our kids can access, but as all of you know, there are barriers to accessing those important supports for our young children. What suggestions do you have for working around or overcoming those barriers? So I'm going to start this question with Kathy.
Okay, barriers. Traditionally, the limited supply of child development programs, the cost of programs, the complicated eligibility requirements for child care subsidy programs have been major barriers for children in the child welfare. Today, the Child Care Bridge program has substantially alleviated the cost barrier for children and the time barrier. Prior to this program being instituted, most kids in child welfare never got closer to care than the waiting list. And the Child Care Bridge program is designed to provide immediate access to children in child welfare to child care. And the way it works, and it's included on the handout, but basically the children's services worker will refer the resource family to the Child Care Alliance, who will then put them in touch with the appropriate child care resource and referral agency in the resource family's community. And then they have a navigator who will work with that family to identifying a child care option for them, negotiating the contract, and getting that all signed and in place. Um, the program is designed to provide care for 6 months. And during that 6 month period, the family works with the navigator to transition a child to a long term source of child care subsidy. If it doesn't happen within the 6 months, the program can be extended for another 6 months. Um, and I do want to share that unfortunately, the Office for the Advancement of Child Care and Education has reported a substantial loss in the child care supply as a result of the pandemic. Uh, we've lost about, let me see here, I think it was about a third of family child care homes have closed, and almost 2/3 of child care centers have closed. So the supply isn't like it used to be. And once the pandemic is over and we're all back to normal, when that happens, um, it's going to take some time for that supply to rebuild. But I guess the most important thing I would say for resource families is get to know your local child care resource and referral agency for help with the Child Care Bridge program and any other resources that might be available. That's it.
Kathy, what's a child care resource and referral service for our attendees?
Okay, there are 8 of these agencies. Each of the agencies has a specific service area in the county, and they provide help to parents who are looking for childcare, help them find it. Most of them also operate childcare subsidy programs. And they also, and then the other services can really vary depending on the agency and what funding they've been able to locate. But they provide support services to childcare programs, to family childcare providers, information on local policies, state and national policies affecting childcare and development, a range of services, toy libraries, ongoing seminars and support. So a whole range of activities.
Thank you very much for that. So I'd like to ask Griselda to talk a little bit more about the barriers that folks have in accessing the supports and what suggestions you have for working around or overcoming these barriers.
Yes. So for us, our children who are coming from the child welfare system, some barriers that I can easily identify are when they're placed with foster families, which Laura, you and I discussed a little bit about, is holder of educational rights. And oftentimes, in order for our little ones to receive regional center services, we have to have the holder of educational rights identified in their file prior to us moving forward. And sometimes what happens is if a child is recently being investigated or they're recently placed, chances are the biological parents continue to hold all educational rights for their child. And so if, let's say, the family lives in far away, right? Let's say San Bernardino, and they come to live in the South LA area. So they're placed in the foster home in South LA, and the parent lives in San Bernardino. It's hard to get us together. And so that's oftentimes a big barrier. And sometimes, they'll switch. Let's say they're assigned to a CSW who was the investigating CSW who made the referral, but now the case is substantiated. And so therefore they get assigned to an ongoing CSW. There's a miscommunication that happens. And oftentimes, luckily, our program managers have worked closely with DCFS, and we actually have an email that we use as our support site when we can't find or identify who is the corresponding CSW to the child, but there still is that it could still continues to be a barrier, the communication between DCFS and regional center services, because sometimes also the child will be given back to the parent and we're not told. Therefore, our vendors that are going into the home, or right now with COVID, who are doing it through telehealth, the foster parents just stop answering the calls. And so then we get a, oh, this family has gone MIA, and we're trying to find out or determine where did the child go, or are they placed back with the parents? Are they sent to another foster home that is out of our catchment area? Because we do work by catchment areas. And so if they're not within our catchment area, we have to ensure that we're transferring the case so that the child, there isn't a lapse in service. And so that has oftentimes been a barrier. And so for me, I just think that, you know, I think we have a couple of people on here that do work in the child welfare system. Is just don't forget about us. We're a great resource for our little ones. And if we can all stay in the loop and have open communication, we would appreciate it, us that have full caseloads. And most of the time, like I said, we do have a lot of babies who are in the system and are placed in foster homes. And so it would make it, don't think about it, oh, you're trying to make my job easier. Think about it for the child, and think about it that we don't want it there to be a lapse in service for them, and that we are providing that support, not just to the foster family, but also to the biological parent as well.
So I know LA County is unique in that it has 7 independent regional centers, whereas the rest of California might have 1 regional center for 3 counties. So what might be your suggestion if the young child is moving to help facilitate that transfer between 2 different agencies so that there's not that disruption in those very important early start services?
So the sooner we know, because transferring a case does take a while. I mean, as most systems, we have to ensure that everything is in place as we're as we're trying to navigate the transition or the transferring of the file. So for us, the sooner we know, the better. We can initiate that transition as soon as possible. And then oftentimes the child's age does play a factor, because if they're closer to aging out of early start services, we won't transfer the case. We'll keep it to ensure that there's a connection between the local educational agency, which typically are school districts, to ensure that, you know, if they do qualify for an IEP, that they have that, because an IEP they're able to take with them to the next school district, and they're able to have those services. So for us, the sooner we know, the better. Or if any information, or if the case does get transferred to another CSW, letting us know. As I mentioned, the email, the support site email that the regional center has with DCFS has been a tremendous help for us. We're able to just send them an email, and they're able to identify and connect us with whomever we need to speak to when it comes to children and with DCFS services.
Thank you very much. And I had some planted questions for you. Charity, would you like to address this question next about the barriers that exist in accessing the wonderful child life services, and any suggestions for working around those barriers?
So in general, I mean, as we've been hearing, you know, the lack of knowledge in child development or interest in investing in young children is definitely a barrier out there. And in child life, definitely also lack of knowledge on child life, as we've always been talking about. And again, the lack of interest in the well-being of our children definitely is a barrier. So while, you know, I believe that our economy is important, we also need to invest in the children, because our children are now seen as a liability rather than assets. And so, and if you think about California in general, not every hospital has child life specialists. Children's Hospital will have child life specialists, but majority of the hospital serves children. There's always some type of emergency department and whatnot that children are walking into, and doesn't really necessarily have somebody that can advocate for them. And in fact, my department, an example would be about, you know, investing. In fact, my department chair and I actually collaborate with Assemblywoman Rubio's office to propose a bill, AB 3175, requesting child life services be available across California, where children are going to be served in healthcare settings. The bill passed the assembly hearing, and we each had like 3 minutes to talk about it. And then, of course, you're always going to have a pushback, right, on the other side of you. The bill fortunately passed at the assembly level, but then it sat on appropriation because of funding. Again, it goes back to, well, how much is this going to cost? But again, it goes back to the money in itself is a huge barrier. But if we look at James Hackman equation, who's an economist, he invests a lot he talks about how we need to invest in children as investing in human capital. Because, and that kind of asset is more of an economic value to the children and for the nation. And so, again, it goes back to, the policy itself that exists or lack thereof to meet the needs of the children. But, if there's anyone who's interested in, continue pursuing that with me at the state level, let me know, because AB 3175 still exists, but again, it's inactive as of that. Again, it's because of funding. So I feel like working together and collaborating together and system talking to each other is going to be really important, because we become really siloed in our own systems, right? And so even now, it's like we don't know certain resources exist until we have events like this. And so there is definitely ever more a need to collaborate for the sake of the children's development.
Absolutely. I have to say, from a personal experience, I had to request a child life specialist for one of my children. And I got this look like, how do you even know about them? And really, you're asking for them? And it's like, yes. And I've had CASAs bring it up for some of our kids that have either chronic or acute medical conditions that they're either at LA County USC or Children's Hospital Los Angeles. I know Miller's has it, UC Irvine has them, but they're not there enough to buffer the trauma of being in a medical setting, whether it's what the children hear, what they see, the procedure they're experiencing. So it adds that ACE, that adverse childhood experience. So having a child life really does provide that buffer. Do you find that the doctors and nurses are responsive when a child life specialist has been brought on a young pediatrics case? You're muted.
If they are familiar with child life, they are very responsive. If they're not, it's still, there's still a question of what are you doing here? But then once they are able to observe how we've been integrated ourselves in there, then oftentimes it has been a great partnership. But again, there is still a need to educate others about child life.
Mm-hmm. Okay, thank you. Adriana, you want to take a stab at what barriers exist to accessing, I'm going to say, early and infant and early mental health services, and how to work around those barriers?
I think this is where I'll need my 30-second because I think I'm gonna jump off where Charity just stepped off to talk about education. And I think one of the biggest barriers to having access to the appropriate services for young babies is that people don't understand children. Mm-hmm. That the image that we didn't get to see, but that you talked about, I think is what people think childhood is about and toddlerhood is about. And people reduce children to their behaviors without understanding what their behaviors are trying to communicate. Mm-hmm. And so we look at where our society is spending and investing our money. And I think about what how amazing would it be to fund prevention services for socio-emotional health, just like Griselda's talking to us about early start.
Mhm.
But here's the catch. When a child has a gross motor delay or a fine motor delay or an expressive speech delay, you can see it, you can hear it. It's right there. For the trained eye, it becomes almost obvious. And sometimes for the untrained eye, you start going, wait, my child used to speak at that age and this child is not, or my neighbor's child used to be able to do this and this child is not. But there's not a lot of general access training to what socio-emotional health is for children 5 and under, for children 3 and under, for children 1 and under, which are statistically the kids who are entering our child welfare system more than any other. And so part of what I rely on to help me think about it in understandable language is the 0 to 3 definition of infant and early childhood mental health, which basically talks about 3 things. It's the ability to form secure relationships. It's the ability to experience a full range of emotions. And it's the ability to explore and learn. So we think about that in the context of a child welfare system and other systems that have sometimes collapsed or confounded conversations around equity and equality. And so we have systems that have the same rules for a 1-year-old as they have for a 12-year-old, for a 10-year-old, in terms of visits, in terms of access to services, in terms of resources necessary. So that's not what babies need. Babies need systems that understand that their brain is developing so rapidly that the 3-month delay in securing services means that you are no longer providing services for the same child you assessed 3 months ago or 6 months ago. And so we need to have systems that work more fluidly for the sake of our babies, because the reality is that if we're not funding early intervention services for socio-emotional health, we're missing an opportunity to impact multiple generations, because all of our early childhood work is dyadic, which means you have to have the adult, hopefully that consistent supportive adult that Dr. Nichols talked about on day 1, with the child, because A, the child is not going to bring themselves to therapy, and B, the child is being formed based on the relationship of the people in that baby's world. A baby can only see itself in the mirror of the people who care for that baby. So we look at the opportunity to impact multiple generations because we are raising an awareness of what's our own experience when we're raising our kids. And, why are we getting frustrated when they get loud? Or why are we getting frustrated when they get quiet? Because the thing is, when we talk about that healthy part of development and we talk about a full range of emotions, it doesn't mean just the convenient ones. It doesn't mean the ones that we're ready for in the moment. It means the ones that the children are feeling in the moment. And so we have the opportunity to educate systems to understand that the behavior of the child is the language of the child. And it's our job as caregivers to understand what the children are trying to communicate. But the problem right now is that we fund problems. We don't fund prevention. We fund diagnoses. We don't fund family strengthening. And so the barriers are that we have systems that do little to support the transitions that the children are experiencing, to understand the developmental trajectory of what the children need. And so we are trying to fix one thing with tools that are totally for a different project.
Okay.
I stopped because I saw my 30-second sign.
Thank you. And I don't even know how to follow up that.
Sorry, I get a little passionate about this because it feels like this is an audience of people who could make a contribution to making it different.
Well, I think all of you are eliciting from attendees as well as myself a lot of passion about working with our younger kids. Both the first day with Dr. Nicholas, our panelists last week, we're here because we want to improve the outcomes for our youngest children and their parents. Yeah. As we all know, 2020 has been a rather unique year because COVID is here. How do you believe that COVID-19 pandemic has impacted the social emotional development of our young children? And what suggestions do you have or interventions or activities for parents and caregivers who are home all day, 24 hours a day, 7 days a week with those 0 to 5 kiddos? So I'm going to start first with Griselda.
Okay, so COVID-19, oh, it's surrounding all of us right now. And so in our experience here at the Regional Center, we've noticed that it has significantly impacted our families, primarily because we do work with low-income families who don't have access to technology. So although we've given them the opportunity to participate via telehealth, whether they're receiving occupational therapy, physical therapy, speech therapy, infant stimulation, which all of our children qualify for, the access to those services through a technology system isn't there. And so we've had to come up with other creative ways. And so something that our regional center did is, in partnership with our Family Resource Center, is we created, based on our caseload, a list of those families who weren't able to participate via telehealth services. And so what the Family Resource Center did was they created on-the-go learning backpacks. And so they were able to have a drive-through, it was an event where the families would drive through or walk up, and we would hand them a backpack with different activities that they can do with their children during the pandemic. We provided them with whatever tools they might need. And so we also provided them with, in the backpack, we put activities, not just for the consumer, but also keeping in mind, we got a little bit background information. So we also kept in mind of older siblings in the home, or even younger siblings who aren't regional center consumers, to help support the families in that aspect. And so that's what we did. And we did have quite a few families who weren't able to participate in telehealth because they didn't have access to a computer or internet access. And their older children, if they did, because most of us have smartphones now, but their older children who are in K through 12 needed to have access to their school programming. So they got the priority, but our little ones. So we try to be creative in how we can help the families during these times.
Thank you, Griselda, for that creative idea of the backpacks on the go and giving the parents some power, the caregivers some power to be able to continue to provide intervention for the little ones when technology failed them. How about Charity? Would you like to go next?
Sure. Are we coming close to 2022 yet? Seriously. But it definitely is quite an interesting time. And, I'm sure we all have a lot more to say about COVID and how it's been influencing children and their emotional development. And especially, and if we're thinking about children in the hospital setting, they are really also impacted by this in so many ways, because now the medical trauma is doubled, right? Because they have their chronic terminal illness on top of the pandemic. and with that, they're limited. They're receiving limited visitations. There's limited resources. And some child life programs actually are not functioning at the hospital even. So there's like virtual support happening. Again, it's been really stressful for everyone around. And so it's, yeah, I mean, children are affected just as much as adults, but we tend to not think about them in our equation most of the time, except for those of us who work with children and cares about children and want to invest our time in children. And so, and then if you think about development in general, whether they're in the hospital or not, social development is impacted because of lack of support system being at their bedside, consistency, right? They're not able to communicate with their friends and peers if they're in the hospital. And even if they're at home, they can't either. And cognitively speaking, guided participation is not really taking place because some of the children may not have the adults that is going to be attuned to them, right? Or investing their time in them because they themselves are working on their own stresses related to their world too. Emotionally, emotion drives learning and being children. And so when they are stressed and families are also preoccupied by stress, everything is disrupting them and their growth. And so again, mental health is a concern, especially if we're looking at children who are at risk in at-risk environments, whether if it's at home, hospital, immigration detention center, and whatnot. There's so many layers in that. So, I mean, as far as even, ideas and interaction goes, Griselda mentioned some great ideas, and definitely for adults to take the time with the little ones to spend time with them, intentional time with them. It's going to be really important, even though as adults, we tend to be, we're stress ourselves with work situation and whatnot. It's, that time is still important as ever. So, I mean, yeah, that's
Is
where
there
I'm gonna stop. Yeah.
a resource that parents or caregivers can go to when, let's say, their child is having or dealing with a chronic medical issue, but they're not able to really go to the hospital because of COVID-19 and limitations, but the parent needs to support them? Is there a place where they can get suggested language to use or ways to approach that with their child?
Yeah, of course. Children Health Line is, definitely our, I mean, like one of the great thing about technology, even though we're tired of it with the virtual world, Google definitely has a lot of resources. And I do have a list of resources that I actually can create one if you can send it out later.
Yes, we can do that.
That would be great. Yeah, yeah. I didn't even think about that, but there are resources and helpful clinically speaking information that parents can go to.
Yeah, especially because I like to say young children have Martian ears, so they pick up and they hear. So it might be really helpful to have language and tools when talking to the young children about what is COVID and what impact is that having, because it's disrupted their normal everyday life and children respond well to structure. So that might be a wonderful resource if you could send that, and then I can share that.
Okay, sounds good. I'll send that.
Okay. Okay, it was giving me a strange error message. So, Adriana, would you like to take a stab at what impact COVID-19 has had on the social emotional development of young children, and what suggestions do you have?
I think I'll take a stab at the first one easier than the second part because it's hard to figure out what to do about it, right? The thing that's amazing is that we are all in the same context. We are all in the same experience throughout the county, throughout the country, throughout the globe. And that makes it very different. There's a couple things that come up immediately. One is I think about, Kathy was talking about the reduction of numbers, and that part on its own is challenging. But when we think about kids and child welfare, it also impacts the number of resource and foster families who are available because there's no childcare and they either have other kids to take care of or they have their own kids to take care of. So the ripple effect of this is big in terms of having that stability that young children need. I think the other part I keep thinking about, I have a little one who is in kindergarten right now. And when, in a world where everything I ever needed to learn, I learned in kindergarten, kids who are in kindergarten right now and have to learn in isolation, they can't learn from their friends. They're not getting that social part of turn taking and waiting and figuring things out. And these kids are at a deficit for some of the key learnings that happen in that environment. The other thing that's happening is that we're all of a sudden yanked from some of the social support networks that we had, particularly multi-generational supports. And so now we have this situation where instead of being excited to see grandparents, we're now scared to see grandparents, either because the grandparents don't know what impact the kids are going to have, or the kids don't know what impact the grandparents are going to have. And so there's this increased anxiety that is happening for the kids as they are exposed to other people that used to be regular supportive folks in their world. The other part is, I heard both Griselda and Charity talk about the virtual services. Well, kids don't really learn social emotional tools from a computer or through a computer. I know that there are many apps and other places where we want to pretend that that's so, but really kids learn based on relationships and true life interactions and responses, in the moment responses that are much quicker and much more valuable to kids than what they see on a screen. Add to that, for those who are able to be in relationship with other people or be there in real life, they're experiencing this most of the time. And the kids need the cues. They need to be able to see your entire face light up or your entire face be surprised or whatever it is that's happening, because that's how they're learning how to be in their world. So for all of these kids, there are major parts of their development that we will have to see in many years, either how well we adapted as adults or how skewed their results will be and what we will have to do to support their socio-emotional growth in years to come. Oh, and I'll say one more thing. Charity made me think of an example of, I had somebody mention to me that they had been in a hospital for a situation before COVID. And then they ended up back in the hospital in intensive care during this COVID phase. They were not scared because of the illness. They were scared because of all of the white coats and extra masks and zippered up rooms and all of those things. So even the things that were scary before are even harder to understand as a young child now.
So building on that, would you have some suggestions?
Oh, right. See? I told you I would be better at the first part. I think that the suggestions are find ways to connect, even if they're not ideal. Practice that socio-emotional development with the kids. If you have young kids at home, act, play, do charades, do things to help them experience all of those different emotions. It's not ideal to do FaceTime, but keep connected to families, extended families, wave, maybe, do whatever you can to keep kids connected. If your agency has access to see-through masks, if you're working with young children, get some of the transparent masks so that the kids can experience. Find ways to help kids have that normal experience of childhood that they yearn for and that they need for their development.
Great, thank you very much. And I was thinking one thing is, if you're not able to visit, maybe read to the children So use the technology we have to read those books that you might normally not be reading in person, and have that interaction and that experience.
Yeah. Yeah, because the one thing technology does bring us is voice recognition.
Mhm.
And the kids are learning who their important people are through that, the sound of their voice and the familiarity of that. So absolutely, whether in vivo or that one not in vivo, there's a huge benefit to singing, reading. Now I sound like a First Five ad, dancing.
Okay. Kathy, would you like to take a stab at a little more of this? You referred to it a little bit about the reduction in number of childcare providers, but would you have any suggestions or ideas on how to support the young children during their social emotional development during COVID-19?
Well, I did want to just point out too that those few kids who are still in child development programs have are having a very different experience. Um, the one positive is that the group sizes have been reduced just for limitation of possible spread. So that's positive. But the whole issue of wearing a mask all the time, um, how they access the equipment in the room is different, and how it has to be sanitized. Um, Social distancing is not something that most 3, 4, 5 year olds are used to. But what I understand is that they're working with it. So um, the, the experience in child development is different now than it used to be. And actually, my hat's off to the staff in child development programs, because when I was working directly with kids, it was that proximity, that touching, that holding, that laughing. That was so much of what I got out of the program that I enjoyed. So my hat's off to them. The other things that I'll say, just my experience is that isolation is for kids who aren't in child development, who've been pulled out and are now very limited in their relationships. That isolation is something we have to, I think, talk about, be aware of, because I think the adults and the kids are feeling that, and let's show how we talk about our feelings, get it out there. When caregivers are caring for young children full days that they weren't before, plus managing school age kids, online learning, that's another stressor. And also for kids in the child welfare, they may not be seeing their biological parents anymore. Those visits have been interrupted. So how do we use technology for the age group where that is appropriate, but how do we talk about it so that the kids, it's not another trigger for abandonment for the kids, this whole situation. The other thing, I think that so many kids are staying inside all the time. The physical activity has been limited, and I think, I don't know, it's still for me, being outside can alleviate a lot of stress, negative behaviors. So the act, trying to be sure that we include enough active play for kids so that we're not at each other's throats when we're in the house. I think for caregivers to take good care of themselves in this challenging time, because it's very hard to be present and positive if you're just at your wit's end. Um, and really, I think it was said before, just take that time to try and just be with the kids, to play, cut a little slack for everybody, just have some fun. Because I think we're going to get through this. It's going to end, hopefully before the kids are 18, and, and to try and take something positive. And I did want to share one other thing, because we talked about the whole issue of relationships. I just want to share with my little CASA child, 7-year-old, the number of new attorneys, new social workers. It's just, and we expect them to share these very deep personal feelings. Um, I don't know how do we expect kids to be able to form good relationships when we don't honor the relationships that we ask them to have. It's just an ongoing challenge, and I just needed to share that. That's it.
Thank you, Kathy. And I agree, our kids, whether they're 16-year-olds or 3-year-olds, have a lot of adults coming in and out, and we have to honor it's their story to tell. It's their life, it's their building those relationships. And with all those changes, we have to understand that maybe they don't want to do what we're asking them to do or form that relationship because of that. So now we're going to wrap up with our final question. And we do have a couple extra minutes in there, unless we have tons of questions in the Q&A box. How do you see that racism impacts the work that you do with young children? And what suggestions might you share to change the narrative? So we're going to start with Charity first on this very difficult question.
Yeah, so of course, racism impacts social emotional development of all young children, let alone children in child welfare. And our children need to have the permission to like who they are, to understand who they are, and need to be exposed to a variety of differences through, obviously we know this through inclusion setting, books, literature, activities at school. I'm sure there's so much we can all say about, how important this topic is. And it should start early on. And, and then if you have time, I would also recommend you look at American Academy of Pediatrics policy statement on the impact of racism on child and adolescent health in itself as well. And I think we could share that on the chat too. But, racism, it's a social determinant of health, and that is definitely has an impact on health statuses of children, adolescents, emerging adults, and their families. Even though there's been progress or attempt to, move towards, I guess, positive outcome, there's still a lot of work that needs to be done. And evidence supports, that there is still continues to be negative impact of racism on health and well-being through implicit and explicit biases in institutional structures and, and within systems and interpersonal relationship. That is all clear. And so there is definitely a need to focus on the role of racism for not just development, but also with children is health outcomes. Because sometimes, there is, regardless of what people say, there's some type of internalized racism that happens that creates health disparities among children. Even if you are thinking about pain levels and how much, the differences in pain medication, it's being used. And so, these are just some case scenarios that I have myself have heard, but again, it's a conversation that needs to start early on, and we have to address it to be comfortable with it. We can't avoid it, right? In any setting, really. So, yeah.
So one question I have for you, how can a child life specialist help to buffer the impact of racism children in the pediatric healthcare settings?
Well, child life specialists with the knowledge in child development, and the background with being aware of differences, and it's definitely is advocating. Our role is to continuously advocate, whether we're in the hospital setting or not. We are the voice. We often are confronting, gently to, medical professionals in our environment or other multidisciplinary teams that are out there that may have, make comments that are not appropriate. So it's definitely is, addressing that when it needs to be. And so we have to be sensitive to that and make that be a part of that conversation. We can't avoid it. because then if we don't speak on it, it's going to continue, right? And so, yeah.
Yeah,
So just because we advocate for the health experience, it doesn't mean child life specialists shouldn't advocate for, hearing implicit and explicit biases and comments. Yeah.
Yeah, because I can see that some of the kids that are the young kids in the system, there's already a disparity, a disproportionality in the child welfare system to begin with. Then you bring in a child that's in the system to a medical setting, and they may not have that adult with them.
Right.
So somebody might do the shorter or the easier intervention instead of probably the more developmentally appropriate intervention.
Right.
Okay, thank you very much. And I think we uploaded the handouts about the impact of racism on child and adolescent health to the chat box. So Kathy, would you answer this question?
If I solve the problem, what do I get?
Lots of clapping, hand raised, smiles that you can see.
Well, this is definitely a challenge. And I guess, Lori, you alluded earlier that there's disproportionality in the child welfare system. So we know that poor and minority children or families are under higher scrutiny and are more likely to have their kids removed than other families. And I think, so there's the big problem, and that needs to be addressed. But in the meantime, I think child development programs need to become skilled at dealing with children who have experienced trauma and dealing with the individual child and not associating the trauma experience with their ethnic or racial background. And it's another level of professionalism that we're putting on a field that's very low paid, and asking them to do everything for everybody. I think the other reality is that research has shown that Black children, particularly Black boys, are much more likely to be expelled from preschool programs than other children. And once again, I think there's the need for early educators to understand implicit bias, and how do we promote diverse teaching teams and really accepting children, and working with the children in the classroom without laying any negative biases on them. We also have seen from research that Black children are frequently treated as if they're older than what they are, and that they tend to get less support as a result of that. So once again, we need a level of awareness in the teaching staff, teaching skills, to deal with these potential implicit biases and the negative impacts on children. We know that children and families value seeing people similar to them in a child development program, hearing their own languages spoken. And in some ways, the early childhood community is quite diverse. The problem, the area that we struggle with is often that diversity is focused at the lower end of the teaching staff, and those are the folks with fewer credentials, and as you go up the pay scale credential, it becomes more white. So I think that I know the early childhood community is struggling with how do we improve the compensation, the professionalism, the knowledge base of early childhood educators, but still maintain that diverse population to serve communities that are extremely diverse, and to really support families and children of all backgrounds. We don't have the answer, but we're working hard, and hopefully we can share some positive learning as we go forward.
Putting on your CASA hat, Kathy, what could a CASA do who's coming to observe their young CASA child in a childcare setting if they're noticing differing treatment or those issues are not being addressed?
I think we put on our advocacy hat and go for it. um, and in a very honest but hopefully helpful way, not just beating people up, but offering resources, showing where to turn for help. And I think sometimes it's just making people an awareness of what I observed, um, can help people. And hopefully a program would be open to hearing what was observed. And if not, then maybe we need to help the resource family find a different setting.
Thank you, because I know that has happened. And as the CASA, you also know that there's been trauma. So they're encouraging the child care center to also look at the child through that trauma lens of what happened to them and help them look at the behaviors or the kind of what I like to say, the non-behaviors when they're very, very, very quiet and they tend not to get that attention as well. So thank you for speaking to that. Griselda, could you take a stab at this question a little bit about what you've experienced from that regional center lens?
Of course. So for us, at the regional center level, we tend, our name says South Central Los Angeles. So oftentimes we get families who think that we're just going to give them per se the bare minimum without acknowledging or fully assessing their child, or if it's a transfer in case from, let's say, Harbor Regional Center or West Side Regional Center, they feel that because those regional centers are in a better area, better neighborhood, that coming to South Central Los Angeles Regional Center, they're going to lose resources and lose services. But in my experience and being in this position, and as I mentioned earlier, I've had the opportunity to attend different trainings at Westside, at Harbor, at Inland. So I've seen, and I've even collaborated and have spoken with other service coordinators, and I've noticed that something that we do, we go above and beyond for for our families, for our children. And I think that the reason why we do it is because we want to ensure that we're not just advocating for the children and the families, because we know that it's also hard. There's a stigma that comes with being a regional center consumer, or I belong to South Central Los Angeles Regional Center. And something that we pride ourselves in is that we are culturally sensitive to all of our families, because predominantly of our families are African American and Latino families. And so we are, cognizant of the way we approach our families and how we speak with them in regards to regional center services. And so I feel that we do a really good job, particularly because we are centered and we do work with South Central specifically. I think in my experience, we've done a pretty good job at not being biased and providing all of our families with the whatever they might need, versus we're just giving it to you just because. Or we've, as I said, we've even gotten transfer in cases when we give them more services based on whatever assessments they come into our regional center with, after reviewing their case and letting them know, we notice X, Y, and Z. What are your concerns? And I think that because we are person centered, we do meet the family where they are, and we do listen, and we do try to take their expertise, because they are their child's expert in their development, and we do listen to them, and we go on that route.
So thank you. One of the things that I have heard in a training probably 3 or 4 months ago, that there's differences in funding provided to the different regional centers. So West Side, even though they may have fewer children, has a different amount of funding coming in, where South Central, I believe, has very high levels of referrals that come into regional center.
Yes, and I cannot tell you how hard. When I first started at the regional center in 2015, we literally only had maybe 3 vendors for speech therapy. which, as I mentioned earlier, speech therapy is our highest qualifying determinant for our children, whereas Westside had, I want to say, 18. And then the rate, that's another one. We cap out at a way lower than our partnering regional centers. And so a lot of vendors prefer to vendor with other regional centers because their hourly rate is going to be way better than the rate with us. And so, yeah, it is true.
So there is some structural, probably racism built into the system from the top down that impacts what can be provided to the families and the young kiddos who desperately need it.
Definitely.
Okay.
Yes.
Okay, so Adriana, how about you wrap up our panel of questions with how do you see that racism impacts the work that you do with young children and child welfare, and what suggestions might you have to change the narrative?
Get your 30-second sign ready, because this is a yet another passion conversation for me. And here's the thing, I don't watch a lot of TV, but I recently saw somebody on TV say that implicit bias and structural racism are not real. Let me just say, I can't relate to that statement, because in the world that I live in and in the world that the families I serve live in, implicit bias is very real, and it shapes the identity of our young children on a daily basis. Structural racism is very real, and it impacts our caregivers and our children's opportunity to get the support and resources that they need on a daily basis. So part of what we need to do is have the conversations. You know, even though we know this conversation's coming, some of us are like, do I say it? Do I not say it? Yes, we say it, because the only way to make it different is to acknowledge it. And so one of the last projects that I got to be involved with when I was with Project ABC was the development of a video and conversation guide on implicit bias. And so that is available through Project ABC. And if you have a hard time finding it, feel free to reach out to me. But the reality is that implicit bias is what is at the core of our preschool to prison pipeline. Kathy talked about the disproportionate numbers for Black boys getting expelled. Charity talked about the disproportionate numbers in healthcare. And in child welfare, the kids under 1 are the most disproportionate rates. So it's not because of the kids, it's because of us, the adults, and what we make up about not necessarily the babies, but about the adults and their ability to either attend to, take care of, or reform in order to be able to be strong parents for the young babies. So what do we do about it is we create spaces where it's okay to have differences of opinion and to learn from each other. One of the things that we do at Allies, we're fortunate that we do have folks who are experienced in early childhood mental health. And so for our early care and education programs, we offer consultation. So we are in the classroom, in person or virtually, offering some observations and some feedback and some opportunities for the teachers to reflect on what choices they're making and where those choices are coming from. So opportunities to have an objective point of view, an unbiased point of view in the classrooms. We're also, I've been involved in efforts to take that same perspective to child welfare and offering reflective practice groups in child welfare, so that again, we can think about where are we making these decisions from? Where are we making decisions about child detainment? Where are we making decisions about child services? And the reality is that when we look at the numbers, it is implicit bias that determines even who is involved in child welfare, who is referred for services and the services they receive. So at Allies, we are actively engaging. I always say with a name like Allies, you have to be part of this conversation. And we are actively creating opportunities, not just within our agency, but with our community partners to have open conversations about our own biases, our own racist practices or principles. And then we also need to get educated about the long-term impact. And I think about, it's a fancy word called epigenetics. And basically what this is talking about is the physiological impact of trauma on our cellular composition, on our being. And so I think about all the people who come from communities that are often identified as having a chip on their shoulder. No, they don't have a chip on their shoulder. They have trauma in their genes. And so we need to take that into consideration when we look at how we engage families. We need to look at that history of oppression and isolation and separation. Separating children from their parents is not a 2018 or a 2020 problem. It has been happening for multiple generations in this country, and not just including slavery, but also including Native American populations. All of those things need to be considered as we look at how we converse with families, how we engage with families, and how we create services that are geared for them and not the people who the research has been done on to call these evidence-based practices that are not always relevant to the actual families we serve.
Wow. Perfect wrap up to our panel's discussion today. I'm just going to leave it at that because Adriana, it's well said. As somebody in here said, Adriana Molina 2020, LOL. So we did have a couple questions I wanted to pose to you as we begin to wrap up the convening, and anybody can answer this. What are some jobs for someone who has a master's in social work and wants to help young children in the system, but does not want to work in child welfare or work for DCFS? Nothing against DCFS, this is the question. Anybody want to take a stab at it? Nobody, huh?
Wait, can you repeat the question, Lori? I
Okay.
want to make sure I'm hearing the actual question correctly.
Okay. What are some jobs for someone who has a master's in social work that mostly helps young children in the system other than working for DCFS?
Any of us? I mean, the reality is we have all talked about the intersectionality between our work and the kids in child welfare. So I think there are opportunities to work with families who are already engaged in child welfare through, I'll speak for my agency, any of our early care and education teachers are in contact with kids in child welfare. Any of our clinicians are in contact with kids in child welfare. Any of our prevention services, family preservation services, all of us are working with kids in child welfare, and none of us are directly impacted or employed by DCFS, but we all choose to partner with DCFS to have the experience of the children be different.
Well, in addition to that, in hospital settings, social works are also there too, in that realm. So.
Okay.
And I would like to suggest that people look to the child care resource referral agencies, a lot of the advocacy organizations, Children Now and the Advancement Project. Those are all areas where one could bring social work skills to a variety of areas that are involved working with children and families, and not necessarily the department, but really it's just checking out all of these different organizations and finding the fit for yourself.
Thank you. Somebody posted in the chat box about how do we change this funding issue at the state level in terms of how it's maybe impacting the funding that's coming down to South Central, that you were only able to have 3 speech and language specialists, but West LA or West Side Regional Center had 18, or making sure we don't, I want to call it, have a desert in terms of service providers in different parts of the county, based on where those providers want to be versus where our kids are and the families are.
So I'm happy to report that since I started with the regional center in 2015 up until now, so 5 years in the making, we've had an increase in getting vendors to vendorize with us. And not so much as we are sharing vendors with other regional centers, they're solely Clark vendors. And so what we've done, and our board of directors have been amazing in advocating for us up to DDS, going to Sacramento, pitching to them how much our children need services through the regional center, and how it's hard for us to secure vendors who want to work with us because there is a disparity in the pay scale with our regional center versus other regional centers. So from in the past 5 years, we have had a great increase. The one field that's lacking, and I think it's just because it's such a I don't want to say difficult field, but physical therapists. We've struggled to find physical therapists within our catchment area. So typically we're sending, our families far away, and if they don't have transportation right now with COVID happening, they don't want to take public transportation. It gets a little bit difficult, but I'm happy to report that we no longer have just 3 vendors for speech therapy. We have a nice amount now. We have, I want to say, well over 20. We've reached out to vendors that are vendored with other regional centers to see if they want to come on board with us and work with us, not stealing their vendors, but working, collaborating. And so, we've been fortunate that, they've come on board and also have their agencies within our catchment area, so that way our families aren't traveling too far to get the services that they need. So I am happy to report that we've advocated, we've up in Sacramento with DDS, and they've heard us, and they've it's not ideally where we want it to be, the pay scale for the vendors, but we're close, and we're not going to stop because the need is there. They know that the need is there, and so I'm confident that we continue pushing and advocating, and I think that we will match pretty soon what other regional centers offer their vendors.
Okay. Well, we don't have any more questions pending. So I just want to throw out, you each have 1 extra minute. If there's anything final words you'd like to share with our attendees in terms of impacting or changing how we improve the social emotional health of our youngest children. By the fact they're in the child welfare system, they've all been traumatized. They've all experienced the trauma that led to being in the system, and for many of them, a secondary trauma of being removed from their primary caregiver. So everybody gets 1 final minute if you want to share anything else. It's kind of open-ended.
Well, Lori, I'll offer some thoughts because whenever I talk about childcare and development, I want to just be upfront and say that in LA County, there are exemplary programs and there are really bad programs. I just think, we just have to say it because that's the way it is. And I think for children in the child welfare system, they're particularly vulnerable, and we have to be particularly careful when choosing a child development program. And I would hope that a resource family wouldn't necessarily place a child in child development until after they've formed a strong, secure relationship with the child, so that the child doesn't feel like, what's up now? Where do I go? Who do I belong to? And I would just always also encourage the resource family never to be late. Don't leave that child be the last one in the program waiting for somebody to pick them up. That would just be too hard. And then my personal beef, high quality child development, high quality preschool. You know what? It looks the same. It's just that one runs longer. And I don't like it when people say child development or child care is bad and preschool is good. They're the same service. It's just one runs longer. And I would also say that the adults in the program are going to be the key to determining quality. Um, and it's the relationships that the child develops that will make it a good one or a not so good one. So I think child development can be a wonderful resource for resource families and a support to a child, but we just have to be sure that it's prepared to serve that child.
And I would add also a wonderful resource to the parent or parents, because that's part of that social connection and concrete resources and other of the protective factors as well. Does anybody else have any final thoughts or words they'd like to share?
I mean, you know, that relationship piece is really important. And so, you know, again, I want to go back to the idea of how we need to really build relationship even among our different roles, even to work, you know, from even from hospital to school to court systems and anything. You know, it's definitely is where we need to work together for them, really. So. And I like to be able to like integrate child life in so many pockets of where all these great programs are. So.
Okay. I would like to say one of the barriers to building those relationships is having common language between different agencies. So I would encourage everyone to try to find out, if you're working with somebody, what's the language of that organization or that area of specialty, and try to build that bridge across. Because underneath, we're probably saying the same thing, but we just have slightly different language in how we're saying it.
Yeah.
To piggyback off of what Charity is saying, and Kathy also mentioned, as far as relationships matter, I think Adriana put in the chat hashtag relationships matter. Actually, the state of California did an initiative, the SSIP, and our focus was social emotional development. And so all regional centers, that is something that we cover when completing intake for our families, and once they are found eligible for regional center services. And I can't stress enough how much we push that foundational piece between the children and the families and their caregivers, and just knowing that even if it's simple, Adriana loves to sing. I'm telling you, I've seen her in different trainings, and singing to your child, we're all gonna sound like a First Five commercial. Just talking to them, listing, labeling objects around the home or outside. It's so important to establish and create that relationship between the child and their caregiver, whether it's a foster parent or whether it's their biological parent or the grandparents. It's so important. And I just, want to end off with that truly relationships do matter. And it's so important to establish the relationship between the caregiver and their child, and keep promoting a positive exchange between caregivers and their child.
Thank you. And Adriana, any final words? I think your co-presenters have been wonderful in their final words to everyone.
So y'all just raised the bar on me. There are a couple things that I think of, and we talked about bias and racism, but we didn't talk about stigma, and it's in there as well. And so I think the opportunity for us as service providers who partner with child welfare is to help families redefine what it means to be child welfare involved, and to check ourselves when we see that a child is child welfare involved, and what do we make up about what that means and what it means about this child. And I think the other part is for us to think about, when we do think about conversations about systemic oppression and racism, that for the families, I don't care what we look like, we represent the system. And we probably represent mostly the systems that have not been supportive of favorable to them. So we need to go in with that humble partner with rather than power over mentality, so that we can support families and truly being able to be present to the kids, so that we can deal with these adult issues separate and help parents be more present, help caregivers be more present, help childcare providers be more present to what is actually happening and what the kids are asking for in the moment. And I think that will make a long-term impact for the young kids that we have access to right now.
I want to thank you all for making today absolutely incredible. I wish I could just listen to you all talk for hours. That would be wonderful, and I would be absolutely inspired. I also want to thank all our attendees for taking this journey with us to better support and advocate for young children and child welfare. I want to extend heartfelt gratitude to Dr. Nicholas, who I know is on the line, and all of our wonderful panelists from last week and this week. I found the words and their wisdom motivating to do better and to be better for our youngest children and their families. I'd also like to thank all of the folks at CASA of Los Angeles who shared their time and expertise and their co-regulation to make the convening not only possible, but organized and impactful. Josh, Avery, Kelly, Kayla, Rosa, Carolyn, Amy, Katie, Andrea, Jewel, Marie, and Megan, you are all awesome. Or as a former staff member used to say, y'all rock. As we close today, I'd like to ask for your help. First, I've been sending out the recordings of the different sessions, but some of them I'm getting emails back saying they're undeliverable. So if you didn't get copies of the convening recordings from session 1 or session 2, please email me at lhalderman@casala.org, letting me know you didn't receive it, and I will send them out to you, as well as session 3 when it's available. Also, you've seen posted in the chat box a link to SurveyMonkey. Like everything, we have to evaluate how we did. So we'd love to get your feedback of what worked, what you valued on the convening, what we can do better, including not having working polls and things like that, or shared screens. And we're also asking if there's anything else you'd like us to know about or related to the convening. And finally, I want to wrap up with a quote from Frederick Douglass. It is easier to build strong children than to repair broken men. So with those final words, I say thank you and adieu, and go enjoy your day before Halloween and your Halloween. And I hope that 2020 gets better than what it has been, and that 2021, I'm going to be political for a brief moment, turns and rounds the corner, so to speak. I had to throw that in, but I really want to thank you all, our panelists and our attendees and our keynote, for an amazing 3 weeks, and continue to do the great work. Thank you.